Hello everyone, I'm honored to have the chance to share my study. I'm Mengfan He. I come from Zhengzhou University, China. The title of my presentation is A Qualitative Study of the Experience of Social Isolation and Loneliness Among Older People with Chronic Disease in the Community. There are five main aspects to this topic. Firstly, I will introduce the background. Social isolation and loneliness are growing public health concerns in our aging society. Increasing evidence suggests that perceived social isolation or loneliness is associated with severe consequences for physical and mental health of older people. This study aimed to investigate the experience of social isolation and loneliness among older adults with chronic disease. Population aging has become a worldwide phenomenon, and China has one of the highest aging rates. Scholars link loneliness and social isolation among the elderly, arguing that loneliness and social isolation among the elderly are the result of the interaction of subjective and objective factors, and that the two are different concepts but are interrelated. Social isolation can be defined as a state in which an individual lacks a sense of belonging socially, lacks engagement with others, and has a minimal number of social contacts which are deficient in fully qualitative relationships. On the other hand, loneliness can be defined as a subjective state based on a person's emotional perception of the number and/or quality of social conceptions indeed in comparison to what is being experienced at the time. Older people with chronic disease are at high risk of social isolation and loneliness. As someone ages, older people experience changes in their somatic functions, social roles, and family structures, leading to reduced social function and social participation, and are prone to poor social networks. Due to the long duration of chronic diseases, low cure rate, high fatality, and many complications, the physical function and behavioral ability of the chronically ill elderly will decline, which will bring about more prominent problems of social adaptation and social interaction, making them a high-risk group of social isolation and loneliness. The health impacts of loneliness and social isolation are widely recognized. Social isolation and loneliness can lead to a variety of adverse outcomes in older adults, such as cardiovascular disease, cognitive impairment, dementia, depression, poverty, and so on. Compared with quantitative study, qualitative research can paint a clear picture of what older people with chronic disease really think and feel, so as to better analyze and understand the phenomenon of social isolation and loneliness of older people with chronic disease in specific cultural contexts. Therefore, this study conducted in-depth interviews with older adults with chronic disease through a qualitative study sub-methodology, and this study aims to explore the real experience of social isolation and loneliness among older adults with chronic disease and provide insights for the future related research. Then I will introduce the methods. This research was a descriptive qualitative study based on semi-structured face-to-face interviews. The study purposely selected community-dwelling older people with chronic disease in Zhengzhou University to explore older people's experiences of social isolation and loneliness, the reason why social isolation and loneliness occurs, and the help they wish to receive. The qualitative content analysis was performed in order to summarize and extract themes from the interview tests. These are the inclusion and exclusion criteria for the study population. Interviews through the following questions. Now I will show the results. A total of 16 interviews were completed. 3 themes were identified: inner emotion, reasons for social isolation and loneliness, deserves assistance. Themes and categories as shown in the table. Next discussion. In this study, we found that older people who experienced social isolation and loneliness are plagued by negative emotions. The occurrence of social isolation in older persons with chronic disease is influenced by a variety of individual, family, and environmental factors. They have found that the poorer the older person's self-assisted health, the greater the risk of social isolation and loneliness, which may be related to the fact that older people with chronic disease have a negative attitude towards self-aging due to poor health and a poor understanding of their own value, which makes them reluctant to interact with others. Family factor is mainly inadequate family support. In an environment of social change, large-scale population mobility has become the norm, and the departure of the younger generation from their parents has resulted in a large number of empty nested elderly people, with fewer chances and fewer opportunities for children to meet with their parents. And once elderly people have encountered problems, they often hide them from their children, which increase the difficulties in their lives. Therefore, more attention and family care should be given to them. What's more, degradation of the community environment is a recognized risk factor of social isolation among older people. A good community environment, quality community services, and comprehensive community facilities can create a harmonized community atmosphere and build a good platform for older people with chronic disease to participate in social activities, thus expanding social relationships and reducing the risk of social isolation among older people with chronic disease. Older adults want to engage in activities such as online socializing, under the guidance of others to meet their spiritual and cultural needs and prevent social isolation. Moreover, older people with chronic disease have also raised the issue of wanting psychological counseling, where older people have professionals to help smooth their negative emotions and maintain a good psychological state. However, community-based services tend to focus on the physical aspects of care rather than the social or emotional aspects. Conclusion. It was found that social isolation and loneliness among older people with chronic disease was not optimistic. Factors resulting in the social isolation and loneliness of older persons with chronic disease are manifold. The occurrence of social isolation among older persons with chronic disease involves a number of aspects, including personal, family, and environmental factors. Multi-party collaboration should be strengthened to help older adults with chronic disease. Elevated negative emotions and reduce the occurrence of social isolation and loneliness. There are two limitations need mention. Firstly, due to the relationship between time and energy, the study limited to one city in central China, which limits the universities and the representativeness of the study. So it has certain limitations. In the future, we can explain the research area to further enrich the research results. Secondly, the study focused on qualitative research with homebound older people with chronic disease in the community, and failed to explore from the perspective of older people's family members and community health service central staff. Follow-up studies needed to explain the scope of the study population and further include interviews with relevant interest groups in order to explore the relevant issues from multiple perspectives. That's all. Thanks for your listening.